Welcome to Healthy India. I'm Lottie Alaric. Well, folks, this is a program through which we try and tackle all your health needs. We try and tell you as to what various diseases mean in different stages. We also tell you as to how to recognize symptoms of certain health conditions and who to go to in the time of an emergency. And we also tell you how certain diseases are to be treated. And we always do it with a set of experts. Today, in this edition of Healthy India, we'll be talking about cardiovascular disease. To talk about the same, I have in the studio an eminent panel of guests. It is my privilege to welcome Dr. Sunil M. Raheja, who is a physician at the GB Pant Hospital. Sitting to his right is Dr. Anita Saxena, who is a cardiologist at the All India Institute of Medical Sciences with a specialization in pediatric cardiology. And to my left is Mrs. Swapna Chaturvedi, who is a dietitian at the All India Institute of Medical Sciences again. So I welcome all three of you to the show. Well, before we start telling you about the disease by way of your questions being answered, I would like my panelists as well as you all to take a look at this report through which you will get a fair idea about what cardiovascular diseases are all about. Let's take a look.
Heart disease or cardiovascular disease is the class of diseases that involve the heart or blood vessels. Epidemiologists in India and international agencies such as WHO are sounding an alarm on the rapidly rising burden of cardiovascular disease for the past 15 years. The reported prevalence of coronary heart disease in adult surveys has risen fourfold in 40 years, and even in rural areas, the prevalence has doubled over the past 30 years. In 2005, 53% of the deaths were on account of chronic diseases and 29% were due to cardiovascular diseases alone. It is estimated that by 2020, CVD will be the largest cause of disability and death in India. The country already has more than 40.9 million people with diabetes and more than 118 million people with hypertension, which is expected to increase to 69.9 and 213 million respectively by 2025, unless urgent preventive steps are taken. WHO estimates that India lost $9 billion in national income from premature deaths due to heart disease, stroke and diabetes in 2005 and is likely to lose $237 billion by 2015. Of further concern is the fact that Indians are succumbing to diabetes, high blood pressure and heart attacks 5 to 10 years earlier than their Western counterparts in their most productive years. Over 80% of cardiovascular disease deaths take place in low and middle income countries and occur almost equally in men and women. Cardiovascular risk of women is particularly high after menopause. Tobacco use, an unhealthy diet and physical inactivity increase the risk of heart attacks and strokes. It is high time that we realized the seriousness of this disease. A healthy lifestyle is the only solution.
Well, folks, those figures are definitely quite scary. So if we go by that report, by 2020, CVD is going to be the largest cause of death in India. So, Dr. Raheja, how seriously do you analyze the whole situation in the country?
Basically, the cardiovascular diseases are on the rise.
Right.
And there were 17.1 million deaths as per WHO statistics. And out of that, 7.1 million deaths were because of hypertension. And now the major concern is that this is on the increase in the India also.
Right,
and
right.
Also in the rural population. And India in the Southeast Asia itself has 32% patients of CVD. And we are likely to get them doubled by 2020. And all this is because of the change in the lifestyle, sedentary lifestyle, our poor cholesterol levels, and stress, change of lifestyle because of the urbanization and industrialization, there is a job stress, and all this is leading to the increase in the cardiovascular diseases.
All right. So, Dr. Saxena, don't you think that it is really ironical that on the one hand, we are all prospering like anything, and on the other, these kind of diseases are so much on the rise. So, how do you really look at this?
It's really a paradigm, as you said, it's ironic. And unfortunately, as we are progressing, our lifestyle is becoming very fast, and besides the risk factors that Dr. Raheja just enumerated, that is diabetes, hypertension, cholesterol, etc., I think there are lots of other risk factors that are adding on to this, and one of them prominent one being stress. And I think with the lifestyle that we have, in addition to unhealthy eating that we have, there's a lot of stress being added. And now we are getting younger and younger people coming back with heart attacks, something that we did not see, let's say, 15 years earlier. So I think it's a state which can be controlled. I'm not very negative about it, but surely we need to do something now. I think as Indians, we are genetically more prone. We are genetically more prone not only for heart disease but also for serious kind of heart diseases, and the same levels of cholesterol that is designed for Western population is perhaps too high for us. So I think there are lots of things that we Indians have specific to our population, to our race, and we need to work on that.
Right. So Swapna, so as we have just seen that we are really, the prosperity is increasing and people are also being much more educated than they were, say, in the last 2 decades. So as a result, but what are we really doing? Is it ignorance, or is it, that they do not want to believe that something like this can happen to us? How would you really rate this whole thing?
Actually, like it has already been pointed out, that it's a lifestyle disease. So, diet and physical activity, these are the 2 major things that I would highlight, can make the situation under control. Basically, right from childhood, we are exposing our children to a lot of things that are available in the market which were initially not there. So, there's a lot of junk food available, high salty things, a lot of high calorie laden foods, and they have access to so many other things. And as adults, because we are working, women are working, it's a very hectic lifestyle for everybody. So there's, a little time to eat at regular intervals. And, people are not eating the right quality of food also that they're supposed to eat. Besides that, physical inactivity. Children are, into computer games and all this. They are glued to the TV for long hours. So physical activity and diet control has to go hand in hand. And they are the major modifiable risk factors which can really help avoiding this CVD problem.
Right. So Dr. Raheja, for the benefit of my viewers, I would like you to really define what are cardiovascular diseases and how can you really simplify it for my people to understand?
Yeah, basically the cardiovascular is a class of diseases which refer to the diseases of the heart and the blood vessel, that is arteries and veins. And it now usually refers to the diseases of atherosclerosis, which starts in the early childhood. And there are studies which shows that the atherosclerosis is basically the deposition of a fatty substance in the inner layer of the arteries. And studies show that they start even at the age of 7 to 9 years in the aorta and the right coronary arteries, and it slowly progresses over the decades till the person develops a heart problem. For example, this we have a model here which shows this is a normal artery and this is the lumen, which is very smooth in the intimal layer of the arteries are very smooth. Now there is a process of atherosclerosis what will do it starts depositing a fatty substance in the lumen. There is an intimal injury which leads to the deposition of cholesterol particles beneath the intimal layers. And because of that there is a narrowing. This is further complicated by the inflammatory reaction by which WBCs, platelets and other cells they deposit in this, and there is a fibrous layer formation over it. And you can see here this has led to the development of a very narrow artery. And because of that now the less blood supply can pass on to the myocardium, and this can develop to the symptoms of angina. That is chest pain on exertion or even at rest, or dyspnea on exertion. And at the same time, because this artery has become very narrow, it is now more prone to be blocked by the blood clots, or this fibrous layer can rupture because of inflammation, and it's a very complex process, and because of that there can be a complete occlusion of the artery lumen, and this will lead to the complete myocardial damage, what we call is heart attack. And basically this takes decades to develop, this atherosclerosis process, and if the same thing happens to the arteries which are supplying to the brain, that will lead to the ischemic stroke, and that is 80% of the total strokes. In that we have that thrombotic and embolic. In thrombosis when there is, and 20% we have the hemorrhagics, in which there is a leakage of blood into the brain tissue subarachnoid because of hypertension or AV malformations. And at the same time, because the arteries are getting stiffened, this also leads to the increase in the blood pressure of the person, which what we call is hypertension.
Right. So I do hope people that you looked at that model carefully, as Dr. Raheja has just enumerated, and he's told us very clearly as to how this whole process takes place and what is the end result, and which I'm sure is pretty scary. But if you take charge in time, this is something that you can really take care of and avoid it, definitely. Now, Dr. Saxena, if we talk about heart diseases or cardiovascular diseases, this is something that people believe, though it is going to happen to me or may not even happen to me while I get old, only when I get old. But as we are seeing, as he said, that the incidence is rising even in children. So, as a person, as a doctor who deals a lot with pediatrics, what would you try to, like to tell us all?
I think this is a very, very important point, and I think pediatric age group is the time when we can actually work on it, because by the time the patient presents with symptoms of angina or chest pain, it is too late to prevent anything. What we do basically after that is just try and treat the symptoms by various means, including surgery, angioplasty. But the basic disease has already developed, it has already blocked the artery. And as Dr. Raheja pointed out, the problem of atherosclerosis starts very early in life. Second decade, there are studies which have shown that there is already a, a plaque or a atherosclerotic narrowing in children, and which obviously goes unnoticed because the children are happy, the artery is still open. And that is the time when we can really inculcate the right kind of habits in children, especially the physical activity part and diet modifications, which can at least slow down the progress of the disease, if not completely take care of it. So I think this is probably a disease which originates in children, but manifests in adults or elderly, and the time to work on it or time to prevent it is actually in children. And if we don't do it at that time, then we've really missed the bus.
That's right. Well, I'm glad you mentioned that, because most of us have all along been believing that something like this or a condition like this only happens during old age. But people, if you are watching today, please keep that in mind. And if you do not have time for your children, now this can be really quite dangerous in the times to come. So, Swapna, again, I'd like to come to you here, that now that this incidence is rising in children, what are the most common causes for this? Does it have only to do with the lifestyle, or does it have even, say, we can talk of a lot of adulteration as we see in the foods today? So what would you point down the cause to?
Basically, if you look into the dietary patterns of children, nowadays they're exposed to so many things, which are available in the market. There's so much exposure to junk food. They're not eating fiber in the true sense, like the quantum of fruits and vegetables that they should be eating. Because high fiber diets, low fat diets is very important.
Right.
Nowadays, the concept of trans fat has come in, and they are the most or the worst kind of fat which is available, and it can really damage your arteries. Trans fat is available in a lot of potato chips, and French fries and burgers and pizzas, which the children are really hogging on. So they have to be brought under control. So we have to teach our children to eat balanced, nutritious diet. Once in a while, if they are having a proper diet, you can treat them out, but it should not be in habit. And they are also exposed to a lot of aerated drinks, sweetened drinks. So the first thing that happens with them is obesity. They put on so much of weight, and then gradually the other things fall into place. Once they are obese, they become diabetic. Once they are diabetic, diabetes being a progressive disease, then they develop cardiovascular problems, and that is how the progression takes place. So it's very important to look into all these dietary factors.
Right. So the parents who may be watching today, I would like to request you all that please do not pack your love in bottled, in fizzy drinks bottles or in French fries or burgers, and as my dietitian just said, because you may want to feel that, okay, this is how you can pamper your children, but you're actually it's kind of a slow poison that you are giving your children. So please make sure that you do not indulge into any of these kind of food items, so that your children learn only healthy habits. So, Dr. Raheja, would you like to take on from here, because as I think this is something you must be dealing with on a day-to-day basis. Do you think it is the parents who need to be educated much more than the children?
Yes, basically, the living lifestyle, the child learns from the family, school and the peers, friends. So, it is basically everybody which has to take care. And it is the diet which is very important, as we have been discussing. And beside this, the children must be encouraged to do the exercise. They should be encouraged to go out and play, because the studies show that exercise has multiple benefits. It decreases the blood pressure, it increases the HDL, decreases the LDL, and induces the good sleep, mood elevation. It strengthens the muscles and joints. And it is very important, like aerobic exercises, they are very good for heart because they do the cardiovascular conditioning.
Right.
Once a person is doing cardiovascular exercise, there is increase in the heart rate.
Dr. Raheja, I'll have to interrupt you here for a moment, as right now we'll have to slip into a very short break here in Healthy India. But people, do come back quickly, as we still have a lot more to tell you about cardiovascular disease. We'll be back in just a moment.
Hello and welcome to In Transit.
Slumdog is definitely a very important work, because given the fact that it was a far more difficult film to be able to be shot live in Bombay.
Relationships have become duty beyond duty.
Some of my photographs were published in a couple of newspapers and magazines.
Welcome back. This is Healthy India, and today we are telling you all about cardiovascular disease. So people, if you have a question regarding the same, do feel free to call us, as our lines are going to be open in a very short while from now. Our numbers are 1800115314 and 23035420. I repeat, 1800115314 and 23035420. Dr. Raheja, coming back to you again, as we were talking about inactivity and activity. Now, when one goes out and exercises, one just finds, especially when people are there in the parks, you find that they will, sit in groups or stand in groups and just talk about various things, but they think they are exercising, and they will just go about somewhere, breathe for a little while and then again sit down. And especially these youngsters, you find them only with mobile phones, So I would like you to take this opportunity of telling my viewers that what is the right kind of exercise, and as walking is the easiest thing to do, what is the right way of really taking a stroll or walking properly?
Yeah, exercises we can define into aerobics and exercise against resistance. When we talk of aerobics, we have the cycling, jogging, swimming, brisk walking, and inside the house we can do jumping rope, sit-ups, step-ups. And while we have to, basically the aerobic exercises, they involve the long muscles. And because of that, they increase the blood circulation in the body as well as the heart rate.
Right.
And to achieve that, to achieve the cardiovascular conditioning, we have to follow a pattern of warm up, brisk walking, and then cool down. Like a person needs a walking for around 45 minutes.
Okay.
That is a moderate exercise. In that, first 5 to 10 minutes should be warm up, and next 20 or 25 minutes should be brisk walking.
Brisk walking.
Where you can achieve your target heart rate. Okay, and the last 5 or 10 minutes should be cool down.
Okay.
So that because of the acids and metabolites they collect in the muscles, they are wiped off. And target heart rate you can calculate to 20 minus age, 85%. Okay. And if you talk of the exercise against resistance, we can have some small weights in the hand,
Right.
and then do the aerobics.
Okay.
They are the best form of exercises, because in that we are doing the muscle building also. And once the muscle mass is maintained, there is an increase in the metabolic rate of the body as well.
Okay. Well, right now we are joined by Mr. Janki Ram Rao from Maharashtra. So, Mr. Rao, if you can hear me, welcome to Healthy India.
Good evening, Health India.
Yes, please go ahead.
My question is, how can blood vessels be kept in healthy condition for a long time, and they should be taken care from injury?
Okay.
Thank you.
All right. Thank you for that question. So, Dr. Saxena, would you like to take that?
I think that if I understand the question is that how can we keep our blood vessels healthy for a long time. I think I've already emphasized it, that process has to start early in life. It's never too late. Even if you are 30 or 35, you shouldn't be disheartened, because this may be the right time for you. So whenever you can do that, having a healthy lifestyle at that stage will definitely bear fruits later in life for you. We need to basically work hard. Work hard means do a lot of physical exercise, eat healthy, which I think has been highlighted ample number of times in the past also, and do not put on weight. I think these are few things that are in our control, or modifiable risk factors. And of course, if one has a family history of diabetes, hypertension or heart disease, one has to be even more careful, because then genetically you are more prone to develop these conditions, and therefore you need to work little extra than the general population. So I think this is really the mantra. Start as soon as possible, eat healthy, work hard, do physical exercise, and I think the heart will take care of itself.
Right. So, Dr. Saxena, again coming to the children, as we've just seen that the incidence is rising. So, what are the symptoms that parents should keep in mind? Because this is something that the parents would never ever like to believe that, oh, this is a condition that their child could be suffering of. And sometimes if the child is, you know, kind of not able to breathe properly or something, they just feel, oh, he or she may have played a bit too much and all that. So, I would like you to take this opportunity of telling the parents today as to what is it, what are those kind of signs and symptoms that really they should focus on?
I think if we are talking of atherosclerotic heart disease or the, the heart attacks kind of disease, those are really rare in children.
Right, right.
Rare means they do not produce symptoms. But we have a different set of problems in children, and which are basically other kind of diseases, not the heart attack or hypertension, etc. Of course, hypertension can occur in children, and that's another neglected aspect of cardiovascular disease in children, because most of the pediatricians don't believe in taking blood pressure in children. Most of the parents don't ever think that their children can get hypertensive.
Right.
But hypertension in children is not it's uncommon, but it is not rare, and we should not take it for granted, and therefore they should get their blood pressures checked whenever they are visiting a doctor's office, especially so if there is a family history of hypertension.
Right.
So that is something again which sort of goes unnoticed. But we have a different set of problems in children that is called congenital heart disease, where they are born with heart diseases, and those could be really very serious. Those could be minor, like a hole in the heart. I'm sure everybody is aware of it. Some of these holes can really heal with time, and some of them require surgical correction. And the other kind of disease that we have in youngish children and adolescents, which is more prevalent in our country, is called rheumatic heart disease, which is basically involvement of heart valves.
Right.
And that is something again which produces a lot of disability in young population, which is so productive, and that is something we do face still in India, although it has been kind of taken care of in Western population. But in India, we are still dealing with lots of rheumatic heart disease cases. So these are the two heart diseases in children that produce symptoms. And I think the symptoms of breathlessness or symptoms of tiredness,
Right.
etc.
Ma'am, I'll have to interrupt you here for a moment, as we are joined by a viewer. This is Negidhar from Noida.